Okay, well, good morning, everybody. And I want to thanks folks for joining us. We are going to do some COVID update work for folks, both in the public and our individuals involved, of course, with the media. And this is really, we haven't done this in a long time, which has been a great thing. But obviously, we all remember back when we were doing this every day during sort of the heat of COVID. But the situation really is for Albuquerque, one where we've got the confluence of our hospitals now achieving unfortunate overflow status and capacity issues, as has been widely reported to the public, and the very, very difficult situation that our healthcare workers are in addition to these skyrocketing numbers of COVID. And so we're going to provide some updates here, especially with respect to what the city's doing. But we understand that we continue to be responsive to the situation, and the situation unfortunately is getting a lot worse. And there are some federal mandates and requirements that are pending and in the system with deadlines that are fast approaching. And so Albuquerque, as we have been before, is going to be ready to do what we need to do to keep our employees safe, as well as support keeping our city safe. So I think to begin with, a little bit of just brief introductions. We have some regulars, but maybe if you haven't seen them in a while, if we have questions about fire, we have Deputy Chief Armillo on. Questions about APD, we have, of course, Rebecca from APD. We also have Roger Ebner, who continues to be active with respect to our emergency response. We've been doing one flavor of emergency response now for over 2 years. And that has never stopped, but obviously it's dialed up and dialed down and so forth. And so welcome back, Roger. And we also have our Director of HR, Anthony Romero, who's here because of some of these requirements that are coming in place. And of course, we have our own Dr. Mark Demena, our own Fauci type figure at the city of Albuquerque, who is our interim director of environmental health. And again, has been working on this for now over 2 years. So let me begin with just a little bit of a picture of where we're at. And I'm going to change over to PowerPoint here. So stand by with me. And gosh, it's been so long in Zoom. I don't even, I have to find the share button here. So give me just a moment. Okay. All right, so I think you can all see my screen, and we've been running these city comparisons. We continue to run them. I look at them every, whatever it's needed. Sometimes it's every couple of days, sometimes it's every couple of weeks. And again, this is just an overall snapshot of where we are with respect to other cities. And, this is just important to note because, again, like a lot of challenges, whether it's even violence or homelessness, we're dealing with American challenges that obviously affect us. And so COVID is no different. We do need to take a moment to just sort of understand the context. And so you can see, of course, we know COVID is up nationally everywhere, but these are sort of our comparable cities that we've been using. And you can see that in terms of the number of cases, and again, these are per capita or per 100,000 is the convention. You see us actually the second lowest out of these cities. So only Austin with a lower number. And that obviously is a good thing. So I think it is important to remind everyone that Albuquerque, look, on a relative basis, we're doing much better than a lot of the cities around us. And I continue to be grateful to live here and not in those other cities. And especially when it comes to things like hospital stress and so forth, these numbers are important, but nonetheless, they're still extremely high. So most of you will know what these numbers look like in the past and so forth, but as has been displayed for the state, these are the highest numbers we've seen since January of last year. Now, if we look at the percentage high for positive tests, it's a similar story here. I think now, because of the sort of disparity between access to tests and also the fact that people may or may not be getting tested, this number is less important than it used to be. But remember, it was one of our initial gating criteria, and we were talking about numbers of like 5%, 7%, 10% to achieve turquoise status and things like this. And we're just literally 100% higher than where we were back in that era. And again, these are sort of city county numbers. So this is pursuant to the Albuquerque metro area. And then we look at vaccination numbers and percentage of population with at least one dose. And, here again, which I think is a positive thing, we're on the higher end of the spectrum. A lot of people ask me about El Paso, and that tends to be correlated with the number of federal workers, which El Paso has some of the highest percentage in the country of. And that's why we believe, anyway, at least their numbers are, through the roof when it comes to percent vaccinated. And you can see us, doing okay there, certainly, kind of on par with the other cities. Now, as we do, let's take a little bit of a look at excuse me, I'm going to fast forward because these slides, if anyone actually wants them, we can show you, but they kind of just tell the same story. But the one I want to also touch on is this one right here. This is, of course, Albuquerque compared to New Mexico and on vaccine distribution. And so if you look at this partial vaccination number or the fully vaccination number, again, Albuquerque metro area doing much better than the United States and the rest of the state. So that's a very good thing to see when it comes to public health. And for us to be, 15 percentage points higher than those around us is a good thing. But of course, this is also where we highlight the fact that, at least 80% of New Mexico passes through Albuquerque once a month for all sorts of things anyway. We care a lot about that state number. That absolutely affects Albuquerque. So those stats there, at least, we've done a good job getting that vaccine out and into arms. We need some help from our friends and family around the state to help raise those numbers up. So with that, let's actually go back now and touch on sort of where we're headed. Basically, what's happening at the city is we're preparing for the federal OSHA regulations that require us on January 21st to require vaccines or testing. And so this is a surprise to no one. The state has been requiring this in some form for several months before that, and now the federal government does. And there's a deadline in place. And so what we're sharing today is that Albuquerque is going to be ready to meet that deadline. And we know that is pending in the Supreme Court. So we will adapt based on what the Supreme Court says. But we also know we fall under the state public health order as well. So we're pretty sure we're going to need to be ready to implement this regardless. And so what this means is that the OSHA requirements are going to require city employees to report their vaccination status, whether or not they've received it by January 21st. And the fully vaccinated means 2 weeks after the second dose in a two-dose series, or 2 weeks after a single dose for vaccines like Johnson & Johnson. That's just definitional things, which again are the same as they are around the country. And also, this does apply, to new employees. We get that question a lot. And as a reminder, the city workforce is roughly 5,000 folks who this will affect. And the folks who are unvaccinated, there are ways to get, you can also get a religious exemption. And we will respect that, but you will have to do testing. So the unvaccinated just have to do testing. Again, this is not a new policy for much of the state or the federal government, but it will be for Albuquerque. And in some ways there is a choice there. So you're welcome to not get vaccinated, but then you do have to get tested. And so without a negative COVID-19 test result, you will be placed on unpaid leave until there's a negative test result. And this also has to do with a lot of those changes with respect to how long is leave based on the CDC guidelines and all of this. So we're basically just updating everything to where it should be on January 21st with respect to state and federal guidelines. And we will be ready then to be held accountable for implementing all of that for our workforce going forward. Now, from the beginning, we've been committed to saving lives and livelihoods, and we're going to continue to do that. We're also going to continue to be flexible. We're going to continue to be patient and understand what's right for our workforce. And so we also know that the city continues to make vaccines easily accessible through vaccination clinics for employees and their families. We've been including families in all our efforts as well. So I think with a little bit more on this, let me hand it over to Dr. Mark Domena. Mark?
Thanks, Mayor. I think we're getting very used to the twists and turns that the pandemic has been bringing us. The one thing that we consistently feel like we can count on is something new to surprise us around the next turn. It's with fond memories. We think about early in the summer where we all kind of thought we might be getting away from this, and that was a very short-lived time. Last time we spoke to you all, we were talking about Delta and the concerns that brought, and hot on the heels of the Delta variant causing such a significant surge around the world and some here at home. Now we're talking about the Omicron variant. So I know we're all getting very used to learning the Greek alphabet we may have ignored previously. Omicron is still the same coronavirus. It still has a lot of the same characteristics, but it also has a lot of changes that it has brought with it. Most importantly, it is a very fast-moving, very infectious variant. Has a lot of capability of moving really quickly and infecting people really quickly. So what we're seeing right now is new records in daily cases, both nationally and here in New Mexico and here in Bernalillo County, Albuquerque. And that very much, despite the high levels of vaccination that we have here that Mayor talked about, and in some other parts of the country, we're still continuing to see just huge amounts of cases piling up. That speaks to the infectiousness of Omicron. So a little bit of good news on that is that there is, if you are already vaccinated, your likelihood of getting severe illness if you aren't exposed to and become sick with Omicron, it would be a very mild illness. The vaccine still does offer a significant amount of protection against infection in the first place. So that's encouraging. But most importantly, even people that may become infected, in some cases, their symptoms are so mild that they just mistake them for allergies or a sniffly nose. And a lot of the people that are getting reported as positive tests, those are actually coming through as people that were tested for another reason, admitted to the hospital for another reason, going in for surgery, maybe took a test because they were exposed at a party and fully expected it to be negative because they haven't had symptoms. So that's very encouraging. It's preventing those people from needing to be hospitalized. It's a very low percentage of Omicron cases in vaccinated people that require hospitalization, very low percentage that are resulting in serious illness or death. So the vaccines are still continuing to provide a significant amount of protection, which is what we hope to see. I would expand a little bit on that idea of taking a test after exposure. One of the things that we can probably say with a heavy amount of certainty and concern is that the number of cases that we're seeing, even though they're record highs, are probably now being underreported because so many people are taking at-home tests and they never report their positive results to anybody. They just take the precautions they've been told to take, stay away from people, isolate for a while, following CDC guidance. So there are probably a lot more positive people out there even than we know. And on top of that, we expect there are probably a lot of people that just never get symptoms, never have that incidental test that they took, and don't know that they're positive either. So there is just a lot of transmission pressure out there right now. There's a lot of people that probably have Omicron, just everywhere you might go. So still a lot of need to be cautious. For those that are vaccinated, as I said, it's a less severe course of illness, but the important part of that is that those people, in some cases, still have the ability to transmit their infection to others. So if you're around someone that's very vulnerable, that is likely to get sick or have severe illness, that for whatever reason hasn't been vaccinated because they can't, or it hasn't had an effect on them because of immune conditions they may have, those people are still going to be at significant risk. So we do want people, even if you're vaccinated, to continue to maintain caution and think about the exposures that you may have, the exposures you may bring home to kids that are too little to be vaccinated, to elderly relatives, immunocompromised, and all the same groups that we've been talking about. The real concern, as Mayor alluded to earlier, is hospital capacity. We know our hospitals have been running very full now for the last several months. People who work in that industry are very tired, very frustrated. They've been doing just this ongoing marathon since this started, and they're at a point right now where there are very high levels, critical standards of care, as we've heard about. So just assuming that, well, if I get sick, I'll go to the hospital is a bit of a gamble because they're having to make decisions in hospitals about who's going to get what level of care, and you're you're at risk of not having space available, or there being decisions about who needs to be given priority. So we just want to do everything we can to push back any further infection and control spread, just like we've talked about with, back when it was flattening the curve. The idea is to take off some of the pressure from the healthcare system. For those that aren't vaccinated, this is the real heart and soul of this message: is you are still just as much at risk of severe illness, hospitalization, and death from Omicron as with Delta, as with vanilla COVID, and all of the variants that have been given Greek letter designations since then. It is still very much a deadly virus. It is still very much a debilitating virus that can make you sick. You lose a significant amount of time, with work or family, putting others at risk. But more importantly, just as likely to end up in the hospital or to end up with severe illness or death. So if you put off making that decision and are on the fence about it, it's still something very much to think about. And if it's not something you're going to choose to do, that's okay, but take very significant precautions. The precautions, that's one thing that hasn't changed throughout this. We still are telling people, you want to avoid crowded spaces, large group gatherings, in particular in mixed vaccination status. There's just going to be additional risk with that. The transmission, again, is extremely high right now. So every setting that you go to where there's a crowd, there's a high likelihood that someone in that crowd is carrying an active COVID infection at that time and could potentially be infecting others. So really think about those family gatherings. And we kind of got through the holidays where there's a lot of that kind of thing going on. Good time to do a little bit of alone time, clean out the garage or something like that, and take some time to thin out the crowds a bit. Again, washing hands, really big, important piece of public health advice at this time of year, even before COVID, because you're going to also prevent the spread of things like colds and flus. But we're still concerned about that with COVID. Wearing a mask anytime you have to go out in public. And just want to quickly mention, there's a lot of buzz out there about using a higher quality mask now. What that message is really about is, because Omicron is so infectious, because it takes such a little exposure for people to get sick, the idea is we want to have the highest protection factor possible. It is now just as true as it has always been. It's more important that the mask fits correctly and provides as tight of a seal around your face as possible. If you have access to a KN95 or an N95 or anything else that's more of a respirator and can wear it in a way that fits tight and prevents air from getting in and around, if it's fogging your glasses, that there's not a seal. That's really more important than what the mask itself is made out of. Cloth masks are still very protective. It just matters that you're wearing something. But if you really want to make the improvements and make the improvement in the fit, make sure that it's something that makes a tight seal around your face as much as possible and keep it on. That means covering your nose as well. All of that being said, we anticipate this surge is going to continue to run on for a while. And as I started by saying, we don't know what the pandemic is going to throw at us next. So we just continue to urge caution. Best protection out there is still to get vaccinated, still to avoid crowds, still to wear a mask. And back to you, Mayor. Thanks.
Thanks so much, Mark. And I think what I would really just touch on, what we'll do is we'll wrap up and do a little Q&A if folks have some questions. But we're also concerned about service levels at the city, and so the connection that we've got to think about is obviously the city as a whole and our collective health. We also have to think about our workers' health, and then we have to think about making sure that we can still provide city services, given the fact that everyone's getting COVID and is out and so forth. So right now, which is good news, city services are not materially affected by COVID. We are concerned about that going forward, and that's one of the reasons why these requirements hopefully will help. But right now, we do not see material impact in terms of services. But I want to remind folks that in the past, we dialed back things like, we were running half our bus service. We were doing things like pushing low priority calls for public safety to telephone and so forth. And so those are all things we will do if we need to. But hopefully with some of these requirements, we'll be able to prevent us or make it such that we don't need to do those things. That is the hope. But we also know that there might still right now be one-off cases, whether it's your park didn't get cleaned up, on Monday and it's cleaned up on Thursday, or a particular bus route for that particular hour, the bus doesn't come. That's probably, again, because of one-off situations of somebody phoning in and saying, hey, I can't come today, and then we're scrambling to get backup. So we do know that those are already happening, those one-off, very low-level situations, and those will likely continue to happen. But again, systematically, services have not been affected, and that's a great thing. And that's one of our goals, and that's why it is important that we adhere to these requirements. So with that, I think we'll hand it over to Maya for organizing our questions.
Yep, so we have our first question from Chris McKee. And Chris, I believe you should be able to unmute yourself now to ask. Chris, it looks like you're on mute still.
Oh, okay. Can you hear me now?
Yes.
Okay, thank you guys. A question for Mayor Keller, and I get this sense from a little bit earlier in your presentation. It seems like the city will still push forward with some kind of a vaccination mandate for city employees, regardless of what the U.S. Supreme Court decides about this OSHA mandate. And if I gathered that correctly, your thoughts on that was based on the state's public health order. But I wanted to also ask you, do you foresee maybe a moment as mayor with the sort of powers that you have at your disposal there, implementing maybe a vaccination mandate for city employees as something that you would do as mayor?
Sure, and I think you appropriately put it that, we're going to be, at this stage, we're going to be ready for the federal mandate. We'll be ready for a state mandate. But what we have in place, it's a subtle difference, but I think it's important, is not actually a mandate. It's a requirement or testing, so that is different than just mandating everyone get vaxxed. So want to be clear, what we are ready for is that requirement for testing or vaccine. And what I'll do is, I think what we've done in the past over COVID is, if we think it's necessary because of the safety of the city, the public health of the city, or because of keeping city services running, we will certainly be open to taking unilateral action. And that's similar to the way we handled it, in the past 2 years with all things COVID. But also, we're gonna go in step with where we think our community is, and so we'll make that call when the time comes, which would probably be around mid-February if we needed to do that. And so we're totally open to it, but we're also open to not doing it if at that time we don't see city services affected, and if numbers are on the way down. And so we'll make that call probably in mid-February. But what we're sharing today is we're ready to do that, and we are willing to do that if needed.
And one follow-up very quickly here. I know that Councillor Dan Lewis has sort of proposed two things out there: a limit on mayoral emergency powers just broadly, and also seeking to bar the city from imposing a vaccine mandate. I wanted to see if you had a response to his sort of proposals as they are sort of broadly stated at this point: a limit to mayoral emergency powers and barring the city from imposing a vaccination mandate on employees.
Well, I think as a new counselor, if he would have asked our administration a little bit about this, he would have learned the following, which is, first of all, the requirements and the mandates aren't actually done necessarily through the emergency order. They're part of essentially work requirements. So his legislation wouldn't actually really curtail the thing that he seems to want curtailed. The second thing is, I just think this is incredibly dangerous and disrespectful to what our healthcare workers are going through right now. After doing this for 2 years, those of us who've been literally here leading our city, we know we have done a good job through the pandemic, and we know it takes flexibility and understanding. So for anyone just to come in on their first day and say, like, we should stop everything, I just think it's really irresponsible and unfortunate.
All right, now we'll move on to Gabe Chavez. Gabe, you should be able to unmute for your question.
Actually, Chris McKee actually asked my questions that I was going to ask as well. So,
Okay, perfect. I'll go ahead and unmute Nancy Laughlin here has a question. Nancy, you should be able to ask.
Hi there. I just wanted to make sure. Can you all hear me?
Yes.
Okay, awesome. Can anyone tell me how many APD officers are out with COVID right now? And then firefighters? That's my first question. And then the other is I wanted to get some clarification on for people who are not vaccinated, how often would they have to get tested? And then you said something about unpaid leave.
Okay, I think we have the right people on the call, so maybe we'll take those kind of in order. So our police and fire, you want to chime in on that piece, and then we'll go to the second part.
Thank you.
I can start. Hi. We, as of today, have 45 firefighters out with positive COVID tests or are under suspicion and are awaiting test results. And one thing I want to point out is that it's not causing any kind of issues with our response at this time. Our contingency plans that we've set in place for staffing are allowing us to fully staff our trucks.
Thank you. And then police officers, how many are out?
Go ahead, Rebecca. I think it's on. So it seems like Rebecca's audio isn't working. Rebecca, maybe what you could do is put it in the chat box. Obviously we can connect you to offline. I'm not sure, or if it starts working, we can change it. All right. Okay, and Anthony, our director of HR, I think can just speak to that leave point.
Yes, good morning, everyone. I know, Nancy, you had first asked about how often the testing requirements would be for, and individuals who are not vaccinated will be required to submit a negative test result on a weekly basis. And the portion that Mayor was talking to earlier is the employee would be on unpaid leave if they are not vaccinated, test, and have a positive test result.
So I just want to make sure that I'm clear on this then. If they are not vaccinated and they have to get tested on a weekly basis one more time, they would be on unpaid leave if they're positive?
So they will be on unpaid leave if they are not, if they do not test negative. So they won't be allowed to enter back into the workplace if they have a positive test result.
Okay, and they'll be tested once a week.
Yes, ma'am.
Okay.
Can you guys hear me now?
Yes.
We can.
Okay, cool. Sorry about that.
It looks like the mic cut out again, Rebecca. If you want to use the chat instead. We do have another question we can get to. Nancy, if you are through with your questions.
I am. I'm just trying to find out how many officers are out.
Right. We'll have Rebecca get to you in the chat.
Okay. Thank you.
So the next question is from Tamara at KOB. She's asking, in terms of testing before workers can go back to work, what plans does the city have to help combat the shortage of tests available in Albuquerque?
So this one obviously is a nationwide and statewide issue. We're encouraged by the cache of tests that the state seems to be either releasing or is about to release. So we're working to do a couple of things. And one is we want to continue to try and provide, as employers do for our employees, access to testing. So that is something that's ongoing, but Roger or Anthony, if you want to add to that, go ahead.
Go ahead, Roger.
Okay. Yeah, the question about our plans to combat the shortage, I'm not sure that we have a lot of capacity for that. As the mayor mentioned, it's in every single state and so on. So, but I think that the CDC is actually looking at that right now, and I believe the president has been meeting with some of the vendors to try to increase capacity.
Thanks, Roger. And what we're trying to do at the city is we're trying to negotiate a contract with either Curative or with Presbyterian, who's our insurer, and so forth, so we can have a city testing clinic. We just don't have any of those finalized yet, but that's what we're trying to do.
Awesome. Next, we have a question from Susan Montoya at AP. Susan, you can go ahead and unmute yourself.
Yes, good morning. Thanks for taking our questions. Since you all had mentioned that the vaccinated could still spread it, why limit the testing to just the unvaccinated, since we wouldn't have a clear picture of how many are actually infected out there when it comes to the city workers?
So we want to encourage everyone to get tested, but because of the testing shortage, that's why we're limiting it to just the unvaccinated. There's no way we could test all the vaccinated and unvaccinated every week. There aren't enough tests and there aren't enough workers to administer those.
So is there essentially two classes of employees being created here? I know within APD, it sounds like nearly 60% of those who have COVID right now were actually vaccinated. So does this really get at the issue if we're not testing more widely?
Well, this distinction is really driven by, again, the OSHA ruling. And so we'll see if the Supreme Court changes that, but then we also have to do with the state ruling, which also creates that distinction. And so if there is a better way to do it, like by testing everyone all the time, and we can actually execute on that, I think that would be better. It's just not practical right now. But that is totally a fair point, and it's something hopefully someday we'll be able to do, just like we do drug testing or marijuana testing. That is actually a much better way to do this. It's just not practical right now.
Thank you, Mary. One more question. What are the efforts to negotiate with the workers' unions, the parameters of the program, so that we get that within collective bargaining?
So we have collective bargaining agreements signed with all our different unions and we call them serieses. And so we've been in communication with them a lot throughout COVID, and we've actually really been grateful for their flexibility as well. Now, what's happening, again, this is pursuant to federal and state requirements. So there is no flexibility for either of us with respect to those requirements. So there's nothing the mayor or a collective bargaining unit can do with respect to that. What we've worked with them on is how we're going to do this. And that's also why we're announcing this and sharing this now, because we've had a chance to work with them and basically come to like the best way we can to make it work under the umbrella of what we're being forced to do by the federal and state government.
Thanks, Mayor. And it looks like Nancy has one more question for Rebecca in the chat about out of APD officers who are out, how many are vaccinated at the moment? And I think that wraps up our questions. I know you're having audio issues if you want to get with Nancy. All right, I think that wraps up the Q&A. Thank you all for joining us today.
All right, thanks.